Hi, are you Miss Stevens? Hi, I'm student Dr. Bell. I've been sent in to do a full physical examination with you today. Is that all right?
Yeah.
All right, awesome. So we're just going to go ahead and get started. I'll just wash my hands real quick. Thank you so much for coming in to do this today.
Thank you.
All right, so we're just going to go ahead and start off taking your vitals. All right, so I'm going to take your blood pressure. I'll just need to steal your left arm from you, okay? Great. Okay. Sorry if it's a little cold. It also might just be my hands. All right, it was 116 over 72, which is great. Okay. I'm just going to go ahead and take your heart rate and your respiratory rate. So if you can just go ahead and lift your hand right there. Okay. Your heart rate was 84 and your respiratory rate was 16, which is also normal, okay? I'm going to just go ahead and start with your head. All right, so I'm just going to be taking a look at your hair. And the hair appears evenly distributed. I don't notice any scaling, and there are no skin lesions, okay? Now I'm going to go ahead and palpate some of their cranial bones, okay? Starting with your frontal, into your temporal, your parietal, and your occipital bones, okay? Then go ahead and look at me. I'm going to be feeling your sinuses really quick, your frontal, and your maxillary. Is there any pain or tenderness with any of those?
Nope.
Okay, great. So now we are going to go ahead and move on to an eye examination. Looking and inspecting the surrounding eye structures, your eyebrows are evenly distributed. There is no orbital edema, and there's no ptosis of the eyelids. Now I'm going to go ahead and move on to the external eye. For the external eye, there's no icterus of the sclera. The corneas appear clear, and the pupils are equal and round. All right. I'm going to go ahead and do some pupillary light testing for you really quick. Okay. So starting out with the corneal light reflex, I want you to just look straight at me, all right? And the light's going to go right in between your eyes. Great. So for the corneal light reflex, there's no strabismus noted, which is normal. I want you to go ahead and take a look right behind my shoulder, okay? Okay, that's direct and consensual, and then direct and consensual. All right, so for the pupillary light reflex, all of that is intact as well. Now we're going to go ahead and do the accommodation, so I want you to go ahead and take a look at my finger, and just keep your eye on it, right? Great, so they converged and they constricted, which is also a normal finding. And we're going to go ahead and look at your internal eye. So again, I want you to look over my shoulder so you're not directly staring at the light, okay? I'm going to come back in. Okay. Notice some blood vessels without hemorrhage, as well as the red reflex was present on that eye. I'm going to move on to this eye, so go ahead and look right over my shoulder. All right, red reflex is present. Okay, and I do see blood vessels without hemorrhaging or AV nicking on that side as well. All right, so I'm going to go ahead and move on to the ear examination. If I could take a look at both of your ears. So for the external ear, they appear symmetric. Okay, there is no erythema and there are no lesions on either side. Okay, moving on to the ear examination. Is there any pain when I'm tugging here?
No.
Or here?
No.
Any pain when I'm tugging here?
Nope.
Or here?
Nope.
Okay, great. I'm just going to go ahead and take a look at the inside of your ears, all right? Okay, so the canal is clear on this side. The tympanic membrane is clear with no perforations. I'm just going to swerve this right over for you. Okay. The canal is clear on this side as well. I visualize the tympanic membrane, which is clear, intact, with no perforations. You see the light reflex on that side. Okay. Okay. Now I'm going to go ahead and take a look at your nose. Okay, so on the outside of the nose is symmetric. There's no erythema, there's no lesions or edema. And I'm going to go ahead and take a look up inside your nose as well. So I want you to go ahead and tip your chin backwards. Right here. Okay. Okay. So there was no edema. The nasal septum was midline with no perforations. And the nasal terminates, there was no swelling at all. Okay. So I'm going to go ahead and take a look inside your mouth now. Okay, I'm going to have you say, open your mouth, stick out your tongue, and say ah, okay? Great. So the midline, uvula was midline, the mucosa in the mouth was pink and moist, and there was no tonsillar exudate. Moving on to the visual inspection of the neck, the muscle tone appears intact and similar on both sides. There is no edema and there's no masses that I can see or any venous distension. Going on, I'm going to go ahead and palpate your lymph nodes, starting with the posterior cervical, the anterior cervical, the supraclavicular, submandibular, and the submental lymph node chains. Okay, any tenderness there?
Nope.
Okay, great. There's no lymphadenopathy in any of those cervical chains, any of those lymph node chains. I'm going to go ahead and move on to the trachea examination. The trachea is midline. Okay, and now I'm going to go on to a thyroid examination. I'm going to go ahead and give you this water for you. Okay, and then when I tell you to take a sip of water, you just go ahead and do that, okay? So I want you to go ahead and bend your chin to your chest and then lean it to the left for me. Great, and I want you to go ahead and take a sip of that water. Okay, great. And I want you to go do the same thing, but lean your head to the right. Okay, I'll go ahead and take another sip of water. Wonderful. All right, and I did not notice any masses or abnormalities of the thyroid in that.
We are going to move on to the respiratory portion of our exam. So if you don't mind, would you please lower your gown? I can help you if needed. Yeah. Great. So I am looking for signs of respiratory distress. I notice no cyanosis, no tripoding, and no use of accessory muscles. Moving on to inspection of your chest, I notice no skin lesions, no pectus excavatum, and no pectus keratinotum. Next, I am going to listen to your lungs. So every time I place my stethoscope on you, I want you to take a deep breath in and out through your mouth, okay? Okay. All right, and can you lift your breast tissue for me, please? Thank you. And the other side, please. Great. And now same thing with your back. Good. And now I'm going to go under your arms. So if you could just lift up your right arm for me. And a deep breath. Great. And the other arm. Good job. All right. Now I'm going to be doing an osteopathic structural exam of your back. So I'm going to run my hand down your back. Let me know if you have any tenderness, okay? Any pain? No. Okay. Next, I want you to give yourself a big hug. Okay. And I'm going to feel your ribs. I feel no subluxations on your ribs. Okay. And next, I'm going to move into a cardiovascular portion of our exam. And I noticed that you have no pulsations or heaves. Next, I'm going to listen to a few points. I'm going to start off with the carotid bruits. When I do this, I want you to hold your breath, okay? So go ahead and hold your breath for me. Good. Now breathe for a second. All right, and let's do the other side. So go ahead and hold your breath. And breathe normally. So next I'm going to be listening to your heart. So first I have the aortic point, which is on the right sternal border, second intercostal space. Next is the pulmonic point, left sternal border, second intercostal space. Next is Erb's point, which is on the left sternal border, third intercostal space. Then I have the tricuspid point, which is on the left sternal border, fourth intercostal space. And then would you lift your right breast tissue for me, please? And lastly is the mitral point, which is on the left midclavicular line, and it is in the fifth intercostal space. Great job, thank you. Okay, next I will be feeling for pulses. So I'm going to start with your carotid pulse. Good, and then the other side. Okay, moving on to the radial pulse. Good, and now I'm going to be moving to the lower extremity. So if you uncross your legs, and do you mind to remove your socks for me? Thank you. Okay, so I'm going to come to the posterior tibial pulses, and then the dorsalis pedis pulses. Good, and while I'm down here, I'm going to be looking for any lower extremity edema, which I see none.
Okay, now we're going to go ahead and move on to the abdominal examination portion. So let me go ahead and help you put this gown back up. Okay, and then we can go ahead and have you lay back really quick. Here you are. Great. Alrighty, and since we are doing an abdominal examination, I'm going to have you lift your gown up underneath the cover real quick. Great. Okay, so starting off with the inspection portion of the abdominal exam, the contour is flat. There is no jaundice or abnormal venous patterns of the abdomen. Go ahead and move on to the auscultation portion. Using the diaphragm in all four quadrants. Bowel sounds are all present. I'm going to go ahead and switch over to the bell so I can listen for bruits, starting with the renal artery bruits. Which I hear no renal artery bruits. And then I'm going to go ahead and move on to the abdominal aorta, which I did not hear any bruits either. Okay, I'm going to go ahead and move on to the percussion portion, okay? You just tell me if there's any tenderness. Making sure to percuss in all 4 quadrants. Okay, I'm going to go ahead and percuss the liver's edge. I'll go ahead and move on to palpation really quick, starting with light to deep in all 4 quadrants. You just tell me if there's any tenderness, all right? And the abdominal aorta. I don't know any abnormal pulsations. I'm going to come over here and I'm going to go ahead and palpate the liver using the hook technique. Okay, and I want you to go ahead and take a big deep breath in for me. Great. And let it out. Okay. All right. That's the end of the abdominal exam portion. I'm going to go ahead and move on to the osteopathic structural exam of the abdomen. I'm going to start with the thoracic diaphragm. And the lumbosacral diaphragm. Followed by the pyloric sphincter and the ileocecal sphincter. Okay, that's all. So I can have you lower your gown, and then I'll hold this for you really quick. We can help you sit up. Okay.
All right, next we're going to move on to the neurologic portion of our exam. I'm going to go ahead and take your drape from you. All right, I'm going to start off with asking you a couple questions. So what is your name?
Miss Stevens,
Where are we at?
the CEC building,
And what year is it?
2023.
Great. So next we're going to be moving on to the cranial nerve portion of our exam. So I'm going to grab my eye card here. And I am going to have you cover your right eye. And I want you to read the lowest line, numbers only, please.
3, 7, 4, 2, 5, 8.
So that is 20 out of 30. Go ahead and cover your other eye and read the smallest line again.
3, 7, 4, 2, 5, 8.
That is again 20 out of 30. Go ahead and open both eyes and read the smallest line you can.
9, 3, 7, 8, 2, 6.
Okay, and that is 20 out of 25. Great. Next we are going to move on to cranial nerves 3, 4, and 6. So I want you to follow my finger with your eyes without moving your head, okay? Good. Next we're going to move on to cranial nerve 5. So I'm going to be touching your face with your eyes closed. Just let me know where you feel me touch, okay? So go ahead and close your eyes.
Left, right, left, right, left, right.
Great. And did that feel equal on both sides?
Yes.
Good. And so for the second part, I'm going to have you clench your jaw. Right down. Good. Okay. Moving on to cranial nerve 7, I'm going to have you make some faces for me. So go ahead and smile real big. Go ahead and frown, and then puff out your cheeks. Great. Okay, moving on to cranial nerve 8. So I'm going to have you close your eyes and let me know which side you hear sound on, okay? So close your eyes.
Left, right, both.
Good. You can open your eyes. Next is cranial nerves 9, 10, and 12. So for this, I need a light source. Okay, I'm going to have you stick out your tongue and say, ah. Great. I notice a midline tongue and uvula, as well as a symmetrical palatal rise. Last is cranial nerve 11. So for this, I'm going to have you turn your head into my hand. Good. Turn your head into my hand. And then shrug your shoulders. Good. Okay, so next we're going to move on to sensation testing. So I'll be testing your arms, hands, legs, and feet. Just let me know where you feel my touch, okay? So go ahead and close your eyes.
Left arm, right arm, left hand, right hand,
Good. And does that feel symmetric on both sides? Okay, go ahead and close your eyes again.
left leg, right leg, left foot, right foot.
Great, you can open your eyes. Next, I'm going to be doing proprioception testing of your toe. So I'm going to sit down. Okay. So I want to go ahead and let you know that this is up for your toe and this is down, okay? So go ahead and close your eyes and tell me where your toe is when I move it.
Up, down,
Good,
up, down.
good. And then I'm going to be doing vibration testing. So this is what the vibration feels like. Can you feel that?
Mm-hmm.
Okay, I'm going to be doing that on your feet. So go ahead and close your eyes, okay? Can you feel that?
Yep.
And then you can feel that.
Yes.
Good. Right. Okay, and you can go ahead and put your socks on so we can stand up. Great. So I want you to go ahead and stand up with your feet together, arms by your side, and I'm going to brace you if you fall. Go ahead and close your eyes. Great. Okay, you can open your eyes and sit back down. Next, we're going to test reflexes. So I'm going to start with your upper extremity reflexes. Just go ahead and relax. Okay. So this is the biceps. Good. Good. I'm going to flip your arm over and do the brachioradialis. Good. Good. And then the triceps. Just go ahead and relax your arm. Good. And then triceps. Hold this arm this way. Go ahead and relax. Good. And then moving on to the lower extremity reflexes, I'm going to do your patellar. Good. And then patellar again. Good. And then finally, the Achilles or calcaneal reflex. Good. Good. Okay, next we're going to move on to cerebellar function testing. So I want you to copy my movement. We're going to flip our hands up and down. Good, and just keep doing that and getting faster and faster. We're going to do that for 20 seconds. Just keep going. Almost there. Good job. And you're good. Great job. Next, we're going to do another test, and it's called heel to shin. So I want you to take your heel of one foot and bring it to your knee, and then bring it down your leg. Great. And now with the other foot, foot to knee, and then bring it down your leg. Great job. Okay, finally, we're going to evaluate your gait. So if you could stand up for me. And if you could walk normally across the room. Okay, and walk back on your tippy toes. And then walk back on your heels. And then finally walk back heel to toe. Great, you can sit back down.
Okay, now we're going to go ahead and move on to the musculoskeletal portion of the examination. Okay, it's going to start up here, palpating your deltoid, your biceps, and your triceps. Okay, and I'm going to do some muscle strength testing. So I want you to go ahead and push out towards me, pull back towards the wall, now out towards the sides, in towards your body. Okay, I want you to put your hands like this. I want you to turn them in against my resistance. Ready? Push in. Great. And then outward. Great. All right, that was a 5 out of 5 for the shoulders. I'm going to go ahead and move on to the elbows. I'm going to palpate the medial epicondyle of the humerus, the lateral epicondyle of the humerus, and the olecranon. Okay, now I want you to go ahead and push up against me like you're doing a bicep curl. Great, and then try and straighten out your arms. Wonderful, that was 5 out of 5. Moving on to the wrists and the hands, I'm going to go ahead and feel the ulnar styloids, followed by the radial styloids, and the carpal bones. Okay, now I want you to go ahead and grab my fingers as tight as you can. Wonderful. Now I want you to close your hands like this. Try and open them. Now open them, and then try and squeeze my fingers. Great, that's 5 out of 5. I'm going to go ahead and move on to the hips now. So for the hip palpation, I'm going to feel the iliac crests, followed by the ASIS, and the greater trochanters. Now I want you to go ahead and push up against my hand to the sky. Do the same thing on this leg. Okay, and I want you to lift your leg up, and I want you to push down on my hand towards the table. Great, and then go ahead and do the same thing with this leg. All right, now you want you to open them towards the wall, and then back in together. Cool. Okay, now I'm going to go ahead and move on to the knees. I'm going to go ahead and palpate the patella, followed by the infrapatellar tendon, and then the tibial tubercle. Okay, I want you to go ahead and kick out towards me on both legs, yep. And then back in towards the table. Okay, and that was 5 out of 5 in all planes. Go ahead and move on to the ankles now. I'm just going to lower down your sock if that's all right. Go ahead and feel the medial malleolus, the lateral malleolus, followed by the insertion point of the calcaneal tendon. Okay, I want you to go ahead and push up towards the sky with your feet. Great, now push down on the gas pedal. Great, it's 5 out of 5 strength for that as well. Okay, I'm going to go ahead and finish up with an abbreviated osteopathic structural exam, feeling the fibular head. Okay, this one's posterior. That's a posterior fibular head as well. And then finally, I'm going to finish off with an ankle swing test. So if you can come forward just a little bit so I can swing your legs a little bit backwards. Yeah. Okay. Okay. So you have an anterior talus on this left foot, which is a positive ankle swing test on that left leg. Okay. All right. That concludes the entire physical examination. I just wanted to thank you for coming in today. Do you have any questions for me?
No, I think I'm good.
All right. Well, thank you so much, and we will see you at your follow-up visit.